Facultad de Ciencias Médicas, case 3720. A 76-year-old man with fevers, leukopenia, pulmonary infiltrates, inglés médico, prevalió en el febrero de 1920. Definitions: leukopenia is a leukemia in the white blood cells. Pulmonary infiltrates, the term infiltrates refers to any substance or type of cell that occurs within or spread through the intestine and of alveoli of the lung. Have a video here.
We will study the X-ray lesions of tuberculosis under three headings: the parenchymal lesions, the pleural lesions, and the primary complex. The characteristic lesion of early tuberculosis is infiltration. It is a soft, fluffy opacity like spread out cotton with tiny opacities merging into each other, interspersed with streak-like shadows. Tuberculosis most commonly starts in the apical and posterior segments of the upper lobe, so the early lesions are often seen behind the outer part of the clavicle. This is a typical early lesion of pulmonary tuberculosis. Note the fluffy nodular opacity behind the right clavicle. This is another early lesion in the right upper zone, appreciated better if you compare it with the apex of the opposite side. In a close-up view, note the cotton-like fluffy opacity. This X-ray shows an infiltration of the left upper zone in an early case of tuberculosis. The close-up shows tiny white opacities merging into each other scattered in the left upper zone. This X-ray shows bilateral early infiltration. Note the shadow of the infiltration in right upper zone and the left middle zone.
Signs and symptoms. During his admission: fever, 38.9 centigrade, chills, cough, night sweats, diarrhea, fatigue, weakness, anorexia, fatigue. In another hospital, hypertension, hyperlipidemia, chronic obstructive pulmonary disease, coronary artery disease, congestive peripheral vascular disease, no insulin-dependent diabetes mellitus, gout, benign prostate, hypertrophic sensational cells, carcinoma of the bladder,
An estimated 1/3 of the world's population is infected with tuberculosis. 1/3. And here's the culprit: the minuscule bacterium called Mycobacterium tuberculosis. But does that mean 2.3 billion people are sick? Fortunately not. Only a small proportion of them actually become sick. To understand why, let's take a closer look at the bacterium itself. When someone with TB coughs, they expel little drops of saliva that fly into the air. Some of them may contain the TB mycobacteria, which can then be inhaled by someone close by. The mycobacteria then continue their journey down the respiratory tract and into the lungs. That person is then infected with TB. And this is where it all becomes a little more complicated. The body detects the invasion and sends out its first line of defense. This includes special cells called macrophages, which engulf the mycobacteria and transport them to the lymph nodes, where they are neutralized. If they're neutralized, the person will have what is called latent tuberculosis. This means they're infected with the bacterium, but they don't have active TB disease, and they're not sick. However, in 5% of cases, the immune system is overwhelmed. The TB mycobacteria multiply and escape, and the person falls ill. This often happens with young children, whose immune systems are not fully developed. In other cases, latent TB can wake up and become active TB. This can happen months later, or even years later, especially in adults with weak immune systems. For example, people who are HIV positive, or who've had organ transplants, or who are undergoing chemotherapy. Once in the lungs, the bacteria may spread via the bloodstream or the lymphatic system to other parts of the body, to the lymph nodes, bones and joints, the digestive system, the central nervous system, the liver, or the heart. So what happens when someone has active TB? Let's imagine the infections in the lungs, as this is the most commonplace. The patient starts coughing, has difficulty breathing, and suffers from chest pains. If these symptoms last for more than a few weeks and are accompanied by fever, night sweats, and weight loss, the doctor has good reason to suspect tuberculosis. The next stage is diagnosis, and then treatment. The battle is far from over.
Conclusion. Due to the fever and leukopenia, which probably indicates an infection, the patient also presents pulmonary infiltrates, which is commonly associated with tuberculosis. Tuberculosis, commonly known as TB, is a bacterial infection that can be spread through the lymph nodes and bloodstream to any organ in the body. It is most often found in the lungs. Thank you.